Hello, I'm Dennis Page. I have a Bioidentical MD practice in Eagle, Idaho, outside of Boise, Idaho. There we have a practice specializing in anti-aging, regenerative, and functional medicine. I did my training at the University of Michigan Medical Center, trained in anesthesiology, and did some additional work in interventional pain management. I attended a conference in Las Vegas, interested in aspects primarily for lifestyle and myself. I have a family history of cardiac disease and was interested in seeing if there were things I could do that were different than my parents and my ancestors had done. After that, I decided to pursue the fellowship training in anti-aging and regenerative medicine. And as a result of that and my interest, met the people with Bioidentical and had an interest to pursue practice in this new and growing specialty. Natural bioidentical hormones are hormones that are identical chemically to the hormones that are in our body, as opposed to the synthetic hormones, which are chemically different. One of the things I'd like to talk about is andropause. And andropause, in distinction with menopause, is a gradual decline in the male hormones. And interestingly enough, men have estrogen, and it's an increase in the level of estrogen that are in the blood. As men age, gradually they don't sometimes realize that they're experiencing this change, but they do have symptoms that are associated with this. Some of the symptoms may be decreasing hair or decreasing muscle mass, sometimes inability to sleep at night, poor concentration, difficulty with memory. With these symptoms, patients can look to rebalance their hormones through, first of all, checking their hormone levels. And if they're interested, they can go online. They could go online to Bioidentical MD and they can do a symptom survey, answering some simple questions to figure out, am I experiencing andropause? It's a significant problem. It goes unrecognized by many men. Many men just think that it's some of the symptoms of aging and it's not to be paid attention to. In addition to symptom relief, what is very important is the preventative side of hormone replacement. It's important that hormones be balanced, not too much or not too little. Some of the things that have been shown through numerous studies to be beneficial are the reversal or prevention of osteoporosis, decreased risk of dementia, decreased risk of cardiovascular morbidities and mortalities. So in addition to quality of life issues, there are numerous important health issues that are important through hormonal replacement therapies.
I'd fall asleep sitting in a chair. I'd have a whole level of wanting to do things was just decreasing. Any type of physical activity was starting to decrease. And when it was brought to my attention by my wife, it became more apparent that something was going on inside. And my wife brought me some literature on bioidentical hormones and on what is commonly now referred to as andropause. And I was going through it. I had some tests done through Bioidentical MD and revealed that some of my hormones weren't where they used to be. And through bioidentical hormone treatment, I've been able to maintain my hormones at a level that allows me now to be more physically active, sleep soundly, increase libido, which is, I got to tell you, it's phenomenal, and it's been a very good experience.
In addition to hormonal balancing, it's very important. Probably 50% of a program of preventing disease is related to fitness and nutrition. Some of the things that we're able to offer to our patients include extensive nutritional assessments where we can determine, for example, the amount of minerals that are deficient in a patient's blood. This helps guide therapy so that we can prescribe the correct amount of replacement in terms of minerals and support. Also important is the fitness aspect, and along with that, We teach patients appropriate ways that are fit and matched with their medical conditions on how they can achieve an optimal fitness to match their nutritional and their hormonal balance program. If you'd like to know more about my practice, you could go to bodylogicmd.com, search Idaho, and you'll find all of my information there.